Disease clusters have occurred in 13 U.S. states since 1976, according to a report by the Natural Resources Defense Council. A disease cluster is a location that shows a statistically high incidence of an illness. The Senate Environment Committee today looked into the issue. This 90-minute hearing is chaired by California Democrat Barbara Boxer.
Hearing will come to order. I would like to begin by thanking our witnesses for coming here today. You traveled long distances, and we're very appreciative of that. In particular, I want to welcome Trevor Schaefer, a brave young man who has overcome so much in his life already, and I met him when he was much younger. He beat cancer that he got when he was just a child, and he is inspiring a lot of people to make sure that others don't have to go through the same thing. Trevor has come out of his experience with great purpose. He's decided to devote his life to helping children who also face the frightening reality of having to beat cancer. Trevor and our other distinguished witnesses are here to testify on a very important issue: the need to better protect our families and our communities from dangerous diseases that occur in clusters. I would like to also recognize the two other witnesses from my state of California, Ms. Erin Brockovich, who I think needs no further introduction. We all know of her work, and Dr. Gina Solomon, who's done a tremendous amount of work on cancer clusters. Without a doubt, our country has made great strides in addressing devastating diseases that were once commonplace. Our nation invested in drinking water treatment plants and wastewater treatment facilities, and these facilities are now essential parts of our public health infrastructure. Despite these great advances, we still have more work to do to address diseases such as cancer and birth defects that take the lives of our children and our family members. According to the Environmental Protection Agency, from 1975 to 2007, rates of childhood cancer have increased by more than 20%. I want to say that again. According to the EPA, from 75 to 2007, rates of childhood cancer have increased by more than 20%. So consider this hearing an alarm bell. The country needs to pay attention to a statistic like this. According to the National Cancer Institute, leukemia is the most common form of childhood cancer, accounting for 20% of the incidences. The greatest number of childhood cancers occurs during infancy, the first year of life. Our youngest and our most vulnerable in our society should not have to shoulder such a devastating burden. When the same disease suddenly impacts an entire family or an entire neighborhood or an entire community, people are rightly concerned that a common factor is the cause. Scientists don't always know the exact cause of the cancer, but we know that when we look at cancer, they usually find its genetics or environmental causes. Just last year, the President's Cancer Panel said that it, and I'm now quoting, "It is particularly concerned to find that the true burden of environmentally induced cancer has been grossly underestimated." Let me repeat that. The true burden of environmentally induced cancer has been grossly underestimated, and I'd ask unanimous consent to enter into the record this report from the President's panel. And without objection, I'll do that. The panel urged the federal government, quote, "to remove the carcinogens and other toxins from our food, our water, our air that needlessly increase healthcare costs, cripple our nation's productivity, and devastate American lives," unquote. Clearly, efforts to address diseases such as childhood cancer and birth defects deserve focused, coordinated, and effective action at every level of government so that we respond in the most effective manner when a cluster occurs. That is why I introduced, along with Senator Crapo, S-76, the Strengthening Protections for Children and Communities from Disease Clusters Act. S-76 is designed to increase coordination, transparency, accountability when federal agencies work to investigate and address potential disease clusters. It's designed to give people in communities a seat at the table to better understand such investigations. And if we learned anything from the battle about chromium-6, we learned that the community was just at sea and didn't know where to turn. They had to turn to an attorney and his able assistant to find out that things were going on in the community that were mimicking their own experiences. This bill by itself is not going to end disease clusters. We know that. But it's an important step in helping our communities effectively investigate and address devastating diseases that still impact our families, our neighborhoods, and our society. The critical importance of our bill can be stated in a simple way. If by working together we can establish the cause of a disease cluster, we can then take steps to end the problem and not waste precious time when so much is at stake, the very health of our families. And that's the simple truth about our bill. And now I'm delighted to call on my co-sponsor, Senator Crapo.
Well, thank you very much, Madam Chairman. I appreciate working with you on this legislation, and I appreciate your calling this oversight hearing on disease clusters and environmental health. This is an important issue, as you have indicated, and I really am glad that our committee is looking into it. I want to thank our witnesses for coming today, Erin Brockovich and Dr. Belcher and Dr. Solomon. We appreciate your making the time to be here and appreciate the information and testimony that you're going to provide. And I want to extend a special welcome to Trevor Schaefer, who, as the chairman has indicated, is from Idaho, and he himself has an incredible history that helps us to address this issue. Trevor is the founder of Trevor's Trek Foundation, and we in Idaho are proud that he is there doing this great work. When he was just 13 years old, Trevor was diagnosed with brain cancer. And with the love and support of his family, and I want to point out that his mother, Charlie Smith, is also here today.
Stand up, Charlie, if you would. Would you stand for a second? Great.
Charlie, thank you for being with us. Trevor relocated from McCall, Idaho, to Boise, Idaho, to undergo surgery, radiation, and chemotherapy. After surviving and recovering from his grueling ordeal, Trevor decided that he wanted to help children with cancer. And so, in 2007, along with his mother, Charlie, he founded Trevor's Trek Foundation. Through raising awareness and research funds to providing mentoring services for young cancer survivors, the foundation is a shining example of how the selfless actions of an individual can make a real difference in the lives of those in need. And as if Trevor's work at the foundation isn't enough, Trevor's also a volunteer with the Make-A-Wish Foundation in Idaho, and he's helped there, the Comprehensive Cancer Alliance for Idaho, to create the Childhood Cancer Strategic Plan. He's also a youth ambassador for the National Disease Cluster Alliance and has organized the first childhood cancer awareness walk in Idaho. You can see that he's very committed. And all of these things have been achieved by a young man who just graduated from Boise State University in 2008. I'm very happy that you could join us today, Trevor, and thank you for coming, and we look forward to your testimony. We're very appreciative of the incredibly hard work you have put into these kinds of issues. Madam Chairman, let me just say briefly that I appreciate the opportunity for this committee to take a closer look at the issue of disease clusters. While we've heard quite a bit about them through books and movies such as Erin Brockovich and such as Jonathan Hart's A Civil Action and others, we've not had a recent detailed discussion about them here in Congress. But we should. And thanks to the effort of people like Trevor and Charlie and Erin and our other witnesses, we will. Today's hearing begins that discussion, and I look forward to hearing from our experts about the scientific research behind the causes of disease clusters, the coordinated response between federal, state, and local governments, and any other information that may be helpful to us. Thank you again, Madam Chairman. That concludes my statement.
Thank you so much. I was remiss. I wanted to introduce another Californian who's sitting next to Trevor's mom, Charlie, and this is a woman who brought this particular issue to my attention. And she's worked with the family and is an advocate for the family and is an author. And Susan Rosser, will you stand up? I'm so proud that you're here, and we're very proud of you in California. And now it's a pleasure to call on Senator Lautenberg.
Thanks very much, Madam Chairman. Many of us in this room are parents, grandparents, and we spend our lives trying to protect our children and keep them safe. And Trevor, my hat's off to you for the work that you've done. You're a living example of what happens when one has courage and determination, and we thank you for what you've done. No parent should ever have to be afraid to send their child into the backyard, to a neighborhood park, or to a school because it might make them sick. Yet, this is the reality facing parents who live in communities where residents are under assault from diseases such as cancer. For example, in the 1990s, a cancer cluster was discovered in Toms River in New Jersey, where children were being diagnosed with leukemia and brain cancer at alarmingly high rates. Toms River is the home of 2 Superfund sites and a number of industrial facilities. An investigation of Toms River by the State and Centers for Disease Control and Prevention found an association between mothers who drank contaminated water and children who developed leukemia. Now, science tells us that children are especially vulnerable when they encounter dangerous substances. And studies show as much as 5% of childhood cancers, 10% of neurobehavioral disorders, and 30% of childhood asthma cases are associated with hazardous chemicals. And make no mistake, you don't have to live near a Superfund site to be exposed to potentially harmful chemicals. They're all around us. Testing by the nonprofit Environmental Working Group found more than 285 industrial chemicals in newborn babies and more than 400 in adults that they tested. Additional testing by the CDC also found hundreds of industrial chemicals in adults, including 6 carcinogens. Studies show that kids whose mothers had high levels of certain chemicals in their blood are more likely to have behavioral and health problems. And that's why we've got to create stronger and more effective regulation of chemicals that could harm our children. An issue that we ought to be tackling on several fronts. I will soon introduce an updated version of my Safe Chemicals Act, which would require that chemical manufacturers prove that their products are safe before those substances end up in our bodies. And I received helpful feedback on the bill last year, and I will incorporate ideas that further improve the bill. And I'm committed to working with the colleagues from both parties to modernize the Toxic Substances Control Act in a way that protects public health and works for businesses. But the need is too urgent to wait while our children continue to be exposed to untested chemicals. And I'm going to be working with Chairman Boxer to mark up a bill in the coming months. We also must pay close attention to what's happening in communities where disease clusters are present and kids face the greatest risk. Now, I'm proud to co-sponsor Chairman Boxer's legislation to make it easier for state and federal agencies to work together to investigate disease clusters and educate communities about them. The bottom line is that we've got to do more to protect our children and grandchildren from conditions and substances that could damage their health and shorten their lives. So I look forward to hearing from today's witnesses about how we can create a healthier environment for everyone, and particularly our children. I thank you very much, Madam Chairman.
Thank you very much, Senator. We're going to call on the 2 senators that are coming now in a moment. I wanted to ask unanimous consent to place in the record support for the Boxer-Crapo bill from the Children's Environmental Health Network, the Breast Cancer Fund, the Sierra Club, the Center for Health, Environment, and Justice in Virginia, the National Disease Clusters Alliance. I want to make sure we get that done. And I also want to put in the record the disease clusters in California that were identified by the NRDC and the National Disease Clusters Alliance. There's 8 sites where they found these clusters. So I will put those in the record. And Senator Johans, you're up next.
Madam Chair, thank you for the opportunity, but I've been called to the floor in about 15, 20 minutes to speak, so I'm going to pass. If I have anything, I'll offer it in written form. And again, thanks for the opportunity.
Thank you so much, Senator. Senator Whitehouse.
I will follow the good senator's example so that we can get on to the witnesses, but I wanted in particular to welcome Ms. Brockovich. We were together years ago on the Children's Health Environmental Coalition, which is a wonderful organization in the chairman's home state, and I'm delighted to welcome her here to Washington. So thank you, Madam Chair, and I appreciate the way you and Senator Crapo have worked together on this.
Thank you so much. Well, we'll get right to our witnesses, and our first witness, Trevor Schaefer, Youth Ambassador and founder of Trevor's Trek Foundation, has been such an inspiration to me personally and to so many people, and inspired me to work with Senator Crapo on this legislation. So we're honored to have you. Trevor, you have 5 minutes, but if you go over a couple of minutes, that's fine. Go ahead.
Thank you, Chair Boxer. I would also like to thank Ranking Member James Inhofe and my great Senator, Mike Crapo, for taking on the issue of childhood cancer and cancer clusters and what they mean to our public health. I would also like to thank all of the senators on the Environment and Public Works Committee for allowing me to address some of these issues today. And I'm so very proud to be able to state that I am here today as a witness for both the majority and minority committee members. Most of you do not know me other than I am associated with S76, also known as Trevor's Law. My hope is that by the end of my testimony, you will not only know me, but you will remember me as the voice of every child in this great nation. As you've been told, I was diagnosed with brain cancer at the age of 13. Until that time, I was thriving in McCall, a small town nestled on the banks of a glacial lake in the beautiful mountains of Idaho. I really had a fairy tale life in paradise. But the carefree days of my childhood changed abruptly and dramatically after my cancer diagnosis. Like a snap of the fingers, I was robbed of my childhood and my innocence. I was thrown into the antiseptic world of hospitals in 8-hour brain surgery, followed by 14 grueling months of radiation and chemotherapy treatment. Unfortunately, I was not the only kid in my town with this pernicious disease. In the same year that I was diagnosed, there were 4 other cases of brain cancer diagnosed. Over a 10-year period, there was an abnormally high number of cancer cases diagnosed there before and after I became ill. What happened in my town continually repeats itself throughout our nation, year in and year out. According to the CDC, 46 children per day, 2 classrooms full, are being diagnosed with cancers unrelated to genetics or family history. As Trevor's Law states, cancer is the second leading cause of death among children, exceeded only by accidents. Many of us young cancer survivors will forever face chronic health challenges resulting from the heroic medical measures used to save our lives. Children who have had cancer often experience confusion and embarrassment as they try to return to a so-called normal life and are dealing with the physical side effects related to their cancer and treatment. I can attest to that. Several years ago, when cancer struck me, I fought so hard for my life. I fought through the countless number of needle pricks, the blood transfusions, nausea, vomiting, and physical therapy so I could live to see the sunrise and the snow fall. I'm so grateful to be alive. Still, the aftermath from the cancer treatments that I have endured have affected me in many disturbing ways. Every morning, I wake up with a ringing in my ear, which never stops. I have trouble with my memory, and I may never be able to have children of my own. How ironic that I fought so hard to save my own life, yet now I may never be able to give life. And senators, I'm considered one of the success stories. Although there has been a significant increase in the cure rate of childhood cancer, children still are getting sick at an increasingly steady rate. In small towns throughout our country, possible cancer clusters exist. Parents are trying to get authorities to investigate these clusters and to discern what caused the disease patterns. Scientists and health activists say that the government's current response to disease clusters ranges from piecemeal to non-existent. Some people are told that their small populations render them statistically insignificant. There's nothing insignificant about even one child diagnosed with cancer and then dying of that cancer without ever knowing why. Trevor's Law seeks to rectify that by allowing people in small communities to have their voices heard and their concerns validated about the environmental impact on their children's health. Environmental toxin exposure is insidious in all instances, yet it affects our children in greater proportion than adults. Children are more vulnerable to chemical toxins than adults because they have faster metabolisms and less mature immune systems. According to Dr. Sandra Steingraber, we are seeing more brain tumors in 4-year-olds, ovarian cancer in adolescent girls, and testicular cancer in adolescent boys. These cancers are rising rapidly, and of course, children do not drink, smoke, or hold stressful jobs. We therefore cannot really evoke lifestyle explanations. There are no good familial links that we know of. We are beginning to recognize that not only prenatal life, but adolescent life is a time of great vulnerability to cancer-causing chemicals, when the connection between health and the environment becomes even more important. Toxins migrate right through geographical boundaries and property lines. Cancer spares no ethnic group, no socioeconomic group, nor any geographical area. In its wake, we are left with the burden of extreme personal and social loss. I would also like to stress that cancer does not only attack the victim, it greatly impacts every member of the family. Siblings often experience concern, fear, jealousy, guilt, resentment, and feelings of abandonment, which can last long term. Relationships between family members can become tense, there can be stress on a marriage, and oftentimes a family breaks up. I vowed that if I survived, I would dedicate my life to helping other children with cancer who otherwise would never be heard. I truly believe that I have been given a second chance at life to convey to you the urgency and importance of addressing the proliferation of childhood cancer clusters and the methods of reporting them. For the children, I strongly encourage your support for Trevor's Law. In closing, I would ask you to consider how much your child or grandchild's life and well-being are worth to you. And while you're doing that, please close your eyes for a brief moment and imagine a world without children. Thank you.
Thank you. Erin Brockovich, who is such a fighter for people who did nothing wrong and suffered. And I'm welcoming you. And Trevor, you touched our hearts deeply, and I thank you.
To Chair Boxer and distinguished members of this committee, thank you for the opportunity to testify today. My name is Erin Brockovich. As an environmental and consumer advocate, I respond to requests for help in groundwater contamination complaints in all 50 states. I currently work on investigations in California, Texas, Florida, Michigan, New York, New Jersey, Alabama, Louisiana, Illinois, Mississippi, and Missouri. I am also a proud mother of 3 wonderful children, 2 of whom are presently serving their country as soldiers in the United States Army, 1 currently deployed in Afghanistan. Each month, I receive over 40,000 visitors to my website, thousands of whom report issues ranging from environmental pollution, cancer and disease, worker injury and illness, and more. These people make up whole communities that are witnessing firsthand the harmful effects that exposures to chemicals, such as hexavalent chromium, have had on them. These communities, both large and small, and in every corner of the United States, are sending out an SOS. From small farming towns like Cameron, Missouri, to small desert towns like Midland, Texas, to the forgotten town of Leadwood, Missouri, where the lead mining tails are so large the children think that they are hills and they play on them. In passing, as the children wave, it is startling to see the palms of their hand gray, soaked in lead dust. And unfortunately, yet again, in Hinckley, California, this is becoming an all too common occurrence. It would appear that most of these communities are under siege by one form of pollution or another. Protecting the health of our families and our children should be our top priorities for us all. Yet the system for investigating, responding, and reporting these concerns is inadequate. This is why I strongly support S-76, the Strengthening Protection for Children and Communities from Disease Cluster Act, also known as Trevor's Law, in honor of this brave young man, Trevor Schaefer. Trevor's Law will bolster federal efforts to assist communities that are impacted by potential disease clusters and will identify sources of environmental pollutants and toxic substances suspected of causing developmental, reproductive, neurotoxic, and numerous cancerous and other adverse health effects. According to the CDC in 2011, 1 in 3 people will develop cancer in his or her lifetime. 1 in 3. As an advocate for the past 20 years, I have reached an undeniable conclusion. There are simply too many cancers in this country and not enough answers. And that is what these communities who reach out to me are trying to do, get answers to the most basic questions. Why is my child, who was perfectly healthy, now sick with leukemia? Why does my daughter have a brain tumor at the age of 10? Why is the same thing happening to my neighbor's kids? Hundreds ask me these questions every week. Today, I would like to share with you a map over here to my left that I have put together over the past 6 months of communities that have come to me with concerns of what they believe and they are seeing to be excessive cancers in their neighborhoods and communities. There's 534 dots on this map today, and what makes me sad is I still have hundreds that I have yet to position on the map. The statistics appear to be alarming. These are mothers reporting to me 6 children on the same block with leukemia. These are mothers reporting to me 15 children within blocks of one another who have glioblastomas. In some instances, it is nurses reporting to mothers the large numbers of pediatric cancers they are seeing in certain communities. This work is being done ad hoc by concerned citizens. We must gather data from the field and act. We must develop national strategies for identifying actionable information. We must take a combined arms approach, if you will, to the battle against disease of our own making. When I talk about this issue, I think of my son, who is fighting a war in Afghanistan. If I were suddenly to find myself in the field of conflict, it would not matter how credentialed I was, environmentalist, PhD, or U.S. Senator. I would take my lead from those who had been on the ground. Make no mistake, I feel as if we are in a war here at home. In this battle, we look to you as our commander. On that map, those constituents, your troops, they are sending you a message, but we're not listening. While the map is not scientific, it does show firsthand experiences are providing us the data that we need. They are reporting to me for help because they are concerned that the pollution in their towns is what's making them and their children sick. I will continue to work diligently to gather greater information and report what it is that they are seeing. This map, I believe, begs us all to do so. We must listen and learn from what these people in the affected communities are telling us. We can't just sit back in the safety of our offices and our own homes and hear these stories and think, that isn't possible. The reports say it can't happen. I'm here to tell you today, they do happen and they are happening. In April 2010, the President's Council declared that the number of cancers caused by toxic chemicals is grossly underestimated and warns that Americans face grievous harm from the largely unregulated chemicals that contaminate our air and water. I was born and raised in a very simple, beautiful lifestyle in Kansas. I happened to be raised by a very strong Republican and military man who actually worked for industry and the United States government as an engineer. He is the very person that taught me the value of clean water, good land, good health, and the respect of one another. It always amuses me when someone believes I have a certain party's affiliation. I find it disturbing for those who assume the environmental activist is anti-business. I always thought growing up that caring for the environment and public health was a conservative thing to do. I have later learned it's just the right thing to do. We all need to come together on this issue. Republicans, Democrats, independents, businesses, and communities. We need government, business, and affected communities to join as one for the betterment of the whole and begin to clean up our messes. We should ask no more of ourselves than we ask of our children. We need to work together to find solutions and learn what I believe my children and countless other children who serve our country are teaching us. We must protect, nurture, and defend what we love and cherish the most. Our families, our health, our land, our water, and our very environment. Chair Boxer and senators here today, I thank you for the opportunity to share this map with you and be a part of this presentation. And I do thank you for your tireless efforts to help make our environment a better place to live.
Thank you so much, Ms. Brockovich. And this map is really unbelievable that people called you. They didn't have another place to go, and you should feel really proud of your record in the past, and that America feels comfortable in letting you know this. But that's what we're trying to work on, is to make it easier for people to report these to us, and therefore we can then take the whole community and bring them together, state, local, community, individuals, and get to the bottom of these clusters, of these disease clusters, some of which are not related to environment, and many of them are. Dr. Belzer, welcome.
Thank you very much, Chairman Boxer, and members present of the committee. I appreciate the opportunity to testify today. I want to make a friendly correction, Chairman Boxer, to your opening statement. I, too, am a California native, so there's a certain imbalance on this panel. I was raised in Torrance, California, and earned my bachelor's and master's degrees at the University of California at Davis. That's a few years ago. Subsequently earned a master's and doctorates from Harvard, and I sometimes regret I was not able to move back.
Well, that's the thing. We miss you. You've left us for Virginia, and can't forgive you for that.
Thank you so much. My parents, my parents sometimes feel the same way. My background is as an analyst, an economist, a risk analyst, and I want to point out that although my 10 years spent as an economist in the Office of Management and Budget normally would make people think that sort of a green eye shade sort of view of someone like me. I want to point out in particular that I shepherded through OMB's convoluted review process, EPA's National Human Exposure Assessment Survey, probably almost 20 years ago now. At the time, it was the biggest attempt to get real-world representative data on environmental exposure. And I'm very proud to have shepherded through. At least 40 papers have been published in peer-reviewed literature because of this project. I'm happy to have played a small role in that. With that as a small introduction, I want to raise a couple of questions here. My written testimony covers a number of scientific and technical issues, but I wish to focus on 4 of them right now. First, how is the term disease defined? Without a clear definition of disease, almost anything could be included within it. We have experience with this problem. The term adverse health effect is used hundreds of times in federal law, but it is either defined circularly or it's not defined at all. This creates a number of problems for us in attempting to be responsive. Now, S76 does not include a definition of disease either. It uses the term adverse effect, but like existing law, it does not define it. Second, how is the term disease cluster defined? A good scientific definition would be both sensitive and selective. Sensitivity is needed to ensure that we miss very few real cases, what statisticians call false negatives. Selectivity is needed to minimize the number of random cases that are incorrectly classified as part of a cluster, what statisticians would call false positives. Now, false negatives are obviously costly. We don't want to miss real cases. But false positives are costly too. They create significant fear and anxiety. They may lead to the closure of parks, schools, and drinking water wells. They depress the market value of people's homes. This also creates a serious problem for scientists who are investigating or would be investigating petitions alleging a disease cluster. The less sensitive the definition, the greater will be the proportion of investigations that come up dry because there isn't anything to find. Now, when scientists come up dry, people often are more angry than relieved. Their trust in government is damaged, sometimes beyond repair. The conventional definition, and it's the definition in S76, has really good sensitivity but really poor selectivity. It is very unlikely to miss a real disease cluster. That means it has a low rate of false negatives. However, it is very likely to misclassify a lot of random cases as disease clusters. That means it has a high rate of false positives. Now, in my written testimony, I've shown how the conventional definition results in a majority of random cases of disease getting misclassified as disease clusters. In my example, 27% of fixed geographical zones had a greater than expected number of cases, and so they would be legislatively deemed to be part of disease clusters. But my data were randomly generated. That means all of my data were false positives. Now, this does not help those who belong to a bona fide disease cluster. Substantial resources will be spent searching for environmental linkages that do not exist. That takes resources away from trying to understand real disease clusters. My third concern, how is the term potential cause of a disease cluster defined? The definition in S76 is in some respects narrow, but in other respects very broad. It is narrow because it focuses on anything subject to regulation by EPA. It is broad because it demands no scientific evidence. A chemical is a potential cause just by being present. No evidence is required that the chemical causes the disease of interest. No evidence is required that any exposure to the chemical actually occurred, and no evidence is required of a dose-response relationship. In short, the problem is the definition does not follow the scientific risk assessment model. Finally, I'm worried about the possibility of subordinating science to law and politics. When Congress attempts to legislate science, science is compromised. That science would be compromised is evident, especially to me, in the way EPA would be directed to bias its risk assessments in a health protective way. This is not science, and it damages the credibility and integrity of risk assessments. Scientists should never be told what conclusion to reach and invited to conduct research in order to support it. To be credible, risk must be estimated objectively. This is a core scientific value, and responsible scientists will not participate in a system in which core scientific values are compromised. Thank you again for the opportunity to testify.
Thank you, and I look forward to responding to your critique. Dr. Gina Solomon, we welcome you. Senior Scientist at the NRDC.
Thank you, Chairman Boxer and members of the committee, Senator Crapo. Good morning. My name is Gina Solomon. I'm a practicing physician. I'm also a senior scientist at the Natural Resources Defense Council, and I'm the director of the Occupational and Environmental Medicine Residency Program at the University of California at San Francisco. Most health professionals at some point in their career encounter a disease cluster. A disease cluster is a mysterious excess of one or more illnesses, such as cancers, birth defects, or neurological disease in a particular workplace or a particular community over a period of time. And these disease clusters are frightening for communities and often frustrating for scientists because, at least in the past, there were limited tools for understanding and solving them. But disease clusters also hold the potential, especially with the new scientific tools of today and that are emerging as we move forward. These disease clusters may unlock some of the mysteries of chronic disease, including birth defects and cancer. When I was a clinical fellow at Harvard in the mid-1990s, I learned about a cancer cluster in nearby Woburn, Massachusetts. 12 children in that very small town got leukemia over a period of just a few years, and most of them lived on just one street in a certain section of town. That cluster, like many, was not discovered by a state or federal agency or scientists, but it was actually discovered by community members who recognized each other when they were waiting in the waiting room at the Dana-Farber Cancer Institute. Ultimately, this cluster was confirmed by scientists, and it provided a very key clue because it was the first time that the chemical trichloroethylene, or TCE, was linked with cancer in humans. And an abundance of science since that time has multiply confirmed that link. So that cluster provided a clue that helped science move forward. This Senate committee held a field hearing in April 2001 in the town of Fallon, Nevada, where within 2 years, 11 children were diagnosed with leukemia. Scientists published a paper calculating that a cluster of this magnitude would occur in the United States by pure chance about once every 22,000 years. Like Woburn, that cluster in Fallon provided clues. Testing in the community revealed that almost 80% of community members had urinary tungsten levels above the 90th percentile of people nationwide. Tungsten was not previously thought to be carcinogenic, but it had never really been studied. This same metal then showed up at high levels in Sierra Vista, Arizona, another community affected by a childhood leukemia cluster. Those two findings triggered a much-needed study by the National Toxicology Program, which is ongoing today, and which may advance the science and help protect public health. Although it's really difficult to conclusively prove what caused any specific disease cluster, what I want to say today to you is that we can gather invaluable clues and hints from these tragic events, and those can then help us solve the mystery of chronic disease. Historically, disease clusters have revealed the link between cancer and asbestos, between peripheral neuropathy and nhexane, between testicular toxicity and male infertility and DBCP, and between liver cancers and vinyl chloride, just to name a few examples. And all of these chemicals are now well known to be dangerous to humans, and one of them, the pesticide DBCP, has actually been banned. All of the other chemicals I mentioned fall under the purview of the Toxic Substances Control Act, and they're actually still in widespread use today. My colleagues and I just released an issue paper documenting 42 disease clusters in 13 states that have been confirmed by investigations, by state or federal investigations. This issue paper is attached to my written testimony. And we found examples such as brain cancers in children and adults at the Acreage in West Palm Beach, Florida, which was brought to the attention of this very committee by Senator Bill Nelson a year ago. Birth defects in Kettleman City, California, including 20 babies born over less than 2 years with birth defects, and 4 children with birth defects so severe that they've since died in a town of only 1,500 people. There are numerous other examples, including the well-known cluster of male breast cancer, as well as childhood cancer and birth defects at Camp Lejeune, North Carolina, where more than 60 Marines who lived on that base have been diagnosed with male breast cancer. This is an extraordinary and alarming finding. It's almost impossible that that could occur by chance alone, and it deserves urgent attention. Some of the much-needed tools to solve disease clusters are found in S-76, the legislation known to many as Trevor's Law. This legislation would direct and fund federal agencies to swiftly assist state and local officials to investigate community concerns about disease clusters and their causes. But it would also create consistent science-based guidelines for a systematic and team approach to investigating disease clusters. These guidelines would be developed in collaboration between EPA, the Centers for Disease Control, the National Institute of Environmental Health Sciences, and the National Institutes of Health. And they would address these issues of statistical significance that are so often so difficult in disease clusters. This bill would also set up local advisory committees to improve outreach and involvement of community members. This is essential to build trust within the community, but also to learn from the community, because it's often community members who have pointed out the critical clues to unlocking these clusters. The other thing that S-76 would do is encourage deployment of powerful new scientific tools like toxicogenomics, toxicity pathway screening, and even analytical chemistry techniques that can screen for hundreds or even thousands of chemicals in people. So I'm thinking today of the residents of all of the many dozens of communities across the country that are affected by confirmed disease clusters, and the hundreds of communities where residents are self-identifying clusters and looking for help. These people have suffered through illness and uncertainty, through hope and loss, and they fought for answers, and in most cases have not received them. But it's not too late for these communities and others like them. We now have the scientific tools, and there's an opportunity to improve and systematize our approach to disease clusters so these communities get the support they need and the answers they seek. Thank you.
Thank you very much. Each of us will have 5 minutes to question, and I would ask you to keep your answers brief so we can get to all of you. I just wanted to say to Dr. Belzer, I want to clarify, on page 7 of our bill, we do use a definition of how a disease is defined, and it is defined exactly the way the National Institutes of Health define disease, word for word. And then we even add an extra paragraph about the fact that if science improves and there's a better way to do it, we will do that. So I do feel comfortable, but I'm happy to work with you if you think there are ways we can make it better. The other thing is, you point out that we force the EPA to look at all the various pollutants, but I want you to point out we don't exclude anything like genetics or anything else. We just say they have to include these, because if they don't, then we'll never know the answer. So I really think that I appreciate your criticism. I know you're a minority witness today that differs from Trevor. But I just think the important thing is to work with us. Would you be willing to do that? If we can tighten this up and you feel better about it, that'd be wonderful. Okay. Trevor, you have testified before that your family's had difficulties in the past with the tumor registry when asking for an investigation. You had problems as a family into looking into this cancer cluster, which is why Senator Crapo and I wrote this bill. Could you describe the importance that you place on government agencies at all levels meaningfully involving family and community members in a cancer cluster investigation? The importance of including the families themselves.
Thank you for your question, Chair Boxer. I believe that the citizens and communities want to look to their government for answers, and when they have questions about what is in their surrounding environment, they would like somewhere to go to talk to where they're not told that they are statistically insignificant, and which is what we were told, and that even if the data we had proved correct, that our town was too small to warrant a study. And so I think that strengthening the coordination and accountability of federal, state, and local agencies is key to creating that line of communication.
Of course, that's what we're doing here. We're bringing together, I think, a more effective way to respond by including the community, so there's no frustration out there, and you get the answers. Ms. Brockovich, your testimony emphasizes the importance of ensuring accountability and transparency when government agencies investigate potential disease clusters. What are the main benefits to the people who are stricken with illness and to other people in their community from increased transparency and accountability as we look at these clusters?
I think it's clearly important to, at a deep level, have the community involved. As Trevor has indicated, of what he was just saying, communities try to reach out to agencies. It can be cancer registries or local agencies, state and or federal, and oftentimes they're just treated as a statistic, and they aren't heard, and they want to be a part of the process. I think that they are distrusting as a community. They want to look to agencies. They believe that they're the ones that are overseeing them, and then when they find out something has slid through the cracks, it begins a distrust process. Mm-hmm. And so for them to be a part of a process with either the companies and clearly their agencies, it begins to reestablish trust, because a lot of times when you don't have that, we're not finding out the information that we need to know from them, which when I'm in these communities, you got to get to know them, kind of be on the ground with them, and they will begin to provide you with information that will give you more answers so we can begin to find a solution. Mm-hmm. So it's very important that they be able to work with you, and they don't feel that they have been able to do that.
And how many people have contacted you for that map that you showed us before?
Thousands.
Could somebody hold up that map so that senators who weren't here could look at it? This is a map that Ms. Brockovich has put together, calls to her because she's famous and she's known for going after these problems. And I would just say, well, this is sort of a rhetorical question, but it's okay. Don't you think that this indicates that people are frustrated? It's unbelievable to me that they would call you, someone in the private sector, rather than call the EPA or the NIH. Maybe they're calling them as well. But doesn't this indicate a level of frustration out there that people don't feel they're being heard?
They don't feel they're being heard, and that's why I started this map of, again, over 40,000 emails that I traffic just to my website each month. What happened for me about 8 months ago was that I kept seeing from communities, we're concerned, we're seeing too many cancers, we're hearing of too many cancers. So that becomes a flag for me when I have not one community, not 5, not 10, but 20 and 50 and 100 telling me the same thing, so I started to map it. And they are frustrated, and they want some answers. And as you said earlier, not everything that when we look into it will be related to an environmental issue. In some instances, it could clearly be, and we may be overseeing it because these people don't just naturally wake up and learn of their friend with cancer and their neighbor, or they get to know each other in the hospital, and they don't realize that they're neighbors within the same blocks. They're very, very frustrated, and they're trying to find a way to reach out, and they don't wake up and go, wow, we should call CDC and report this. We should call the National Institute of Health and report this. And I would have to tell you 80% of the people in their emails to me that have created this map have said, we just don't know where else to go.
Well, I think the Boxer-Crapo bill is really trying to address this, and I hope colleagues will jump on as co-sponsors and we can get this done quickly through the committee. Senator Crapo.
Thank you, Madam Chairman. Trevor, I just wanted to say I found your testimony incredibly informative and compelling. And again, I want to thank you for making the effort to come here and be with us. One of the things that you said in your testimony was you referred to your mother's experience when she went to the local cancer registry in your community to raise concerns about a potential disease cluster, and that she was told that basically your town was too small to warrant an analysis, and that your case was statistically insignificant. Could you just comment a little further about that, about what did you do next after you had that experience?
Thank you, Senator Crapo. Well, what we did is, fortunately, we were able to take it upon ourselves to get the a proper scientists to conduct studies on a personal level to find out some answers and kind of start the ball rolling to see if there were indeed problems in our community.
Did you get assistance from any governmental agencies, whether it be the federal, the state, or the local government, in finding that scientist to help you?
We did not, no.
And I guess that's the next question I was going to ask you. Is you indicated in your testimony that you've found that the government's response is piecemeal to non-existent. I guess that's the reality that you ran into, is you didn't have a formal government direction to turn to where there was a government process in place where coordination was occurring.
Yes, and that's exactly where the statement comes from, is from our experience in that being told that we were statistically insignificant. Absolutely.
Well, thank you. And Erin, in your testimony, you indicate that the CDC's ATSDR, which I understand is the Agency for Toxic Substance Disease Registry, if I've got the acronym correct, you indicate that you think that the ATSDR has serious challenges in identifying and responding to disease clusters. Could you clarify that?
Well, from just experience of 20 years and being out in the field with these communities, and, you know, I talk to them, and as they're trying to track whether there's clusters or not, and we inquire of them if ATSDR has been there, 99% of the time, they have indicated that that agency has made no such effort to come in and find out from the community what's happening. And one thing that I think is really very important that we think might be some flaw in how we're identifying these is these registries and these groups don't come in and watch the movement of where these people are going. Many times, if we find out we live in a contaminated community and we're fortunate enough to do so, we move. And now we've lost track of where these people have gone. And when people come down with cancer, they report it to the state in which they reside. They don't report it to the state and where they're from. And so we could potentially be missing hundreds, if not thousands of people because we can't track their movements and their geographic location, which I think is very important. So from experience in dealing with these communities, specifically with ATSDR, which is agencies that are out there to track disease registries, and they're not there. They haven't been to the communities, and it's frustrating for them, and that's where they feel their voices aren't heard.
Thank you. And Dr. Belzer, could you comment a little bit from the scientific perspective of how we deal with this statistical significance issue when you have a small town where, you know, we all recognize how you have small numbers. What do you do to deal with this problem?
Trevor's experience is something, I'm not familiar with it, so I can't comment on that. But the term statistical significance should normally be used only after an analysis has already been done, when data have already been collected. It's not something that should be said of anything or anyone before data have been collected. It's an odd thing to imagine. I do believe that the terminology, which is normal in classical statistics, is deeply offensive to a lot of people because they understand the term insignificance to mean that they are insignificant. This problem probably could be addressed if the epidemiologists applied a different set of tools that we call Bayesian tools. It takes away from some of that. It's also they're probably superior tools than classical methods for the nature of the problem at hand. But epidemiology understands all that. I think that's just a case of scientists communicating in their own jargon in ways that non-scientists don't fully understand. They could be far more sensitive about it.
All right, I see my time's expired. Thank you, Madam Chairman.
Thank you. Senator Lautenberg.
Trevor, you said something in your commentary, and we so much appreciate your being here. You said you're glad to be alive. We're all glad that you're alive. And I look at you as I'm a professional grandfather. I've got 10 grandchildren, and I know what I want for them. And so far, the conditions that they've run into are relatively mild when compared to cancer. And one of the things that I find so disturbing is that in this place of contemplation and legislation, we often hear sympathy for those who are afflicted with cancer or other threatening to life diseases. But somehow or other, we separate the heart from the mind here, and because we'll get into a talk about costs and what's it cost to save a child's life. It doesn't matter what the cost is. There isn't a family in the world who could wouldn't dispose of all of their assets to save a grandchild or a child's life. I've been fortunate enough to be involved in some cancer research. Dr. Solomon, you ever hear of the Jimmy Fund, the prominent Massachusetts situation? Yeah. Was that also in Woburn, Massachusetts?
That was. Jimmy Anderson was one of the first children diagnosed with leukemia in Woburn. Yeah. He unfortunately passed away. Yeah.
Do you know a physician named Landrigan?
Yes, Dr. Philip Landrigan from Mount Sinai Hospital.
Yeah, a close friend, a good friend of mine, and he supports the legislation that I've proposed, and that is to find out whether these chemicals that are being introduced into products, you name the kind of products, is a very important first step. And I appreciate the fact that all of you are here to sound the alarm and let people know they're not exempt. No one is exempt. We do a lot in this committee of ours, Environment Committee, led by Senator Boxer, to try and get conditions that will protect children's health. And that includes clean air. It includes getting rid of toxins and toxic materials coming out of smokestacks and that kind of thing. But I wonder, do you see communities rising up and saying, that company, XYZ company, dumped their waste here, and they should pay the price that cleanup demands? Do we ever identify, Ms. Brockovich, the companies that say, okay, you've done it, you've fouled the air, you've fouled the water, you've violated our children's health? Is that ever brought to the attention? Because I think it would be a good idea. I ran a business before I came here and struck the regulatory, what did you call your company? Regulatory paycheck?
Regulatory checkbook.
Checkbook. I ran a company called ADP, if you, I've been fortunate enough to be able to respond to the early deaths of my father, 43, my uncle in the same family, 52, my grandfather, 56, all from cancer, all who worked in the silk mills at Paterson, New Jersey, an industrial city. So when the chance came along, I was able to help start a cancer research facility, and it's supported by, do you know Dr. Holland, Jim Holland, by any chance? Dr. Solomon?
I know the name, yes.
He did so much in childhood leukemia. I've got several questions that I would like to put to you, but in keeping some time discipline here, which is not easy for a senator. I would ask you this, Dr. Solomon. The investigation into unusually high cancer rates in Toms River, New Jersey, languished because the New Jersey Cancer Registry was outdated when the investigation began. Looking at the bill proposed by Senator Boxer, the disease cluster bill, wouldn't that have a good effect on situations like this, like the Toms River identity and evaluate disease clusters more quickly? We have to get ahead of the curve on this, and I think it would be a terrific thing to do if we can move it. And lastly, if I'm forgiven for another minute, I've proposed a piece of legislation, which I mentioned here, that we'd like to see all chemicals that go into the products that are then circulated throughout our world identified as being safe for children's health before it goes into the product, so we then don't have to look at, like we do with toxic reform law, which said we should investigate chemicals and see what kind of harm they bring. We've investigated 200 chemicals out of 80,000, and it's not good to have a good idea to have EPA searching for those things that are at fault, as opposed to jumping on the bandwagon, getting this done before. And I would plead with you, be in touch with your senators and make sure they understand the problem they've had. Trevor, you're a soldier in this battle, and we want you to keep on fighting. We're proud of you. Thank you all very much.
Senator, thank you for pointing out that, the Boxer-Crapo bill deals with a problem after the fact. There's no question about it. We're not, nothing in this bill is going to prevent cancer clusters. We're just saying if one occurs, let's have a way to respond. Let's have a way to tell our communities, to the best we can, what are the probable causes of this. First of all, most of all, to protect other people, and also to resolve their questions. But what Senator Lautenberg is talking about is a new way to make sure that before these chemicals are introduced, even more chemicals, that the burden changes so that the person who wants to, the company or the person or the group that wants to introduce the chemical must prove it's safe before introduction. That is a very different and important move, and I, of course, will support you 100%. But these are different approaches to the same issue, but they're complementary. Senator Bozeman. Thank you for being here, Senator.
Thank you, Madam Chair. This is certainly a very, very important problem, and I guess it's one that, because of the nature of communication being so much easier now and the ability to perhaps keep track of things so much easier, it is something that we can address. I guess my concern is really two or three things. I believe very strongly that we need to deal with the problem, and I'm concerned that some of the things that we have in place, the registry program, evidently is not doing a good job. And then also, I guess I'm concerned that we're talking about it being under EPA as opposed to, I guess my question would be, why not the CDC or the NIH or the FDA, or all of these groups have, things that they're involved in a similar way. We're talking a lot about cancer, and cancer is a devastating disease. There's lots of neuromuscular diseases, that are associated with this sort of thing. So I'd really like for you all to talk about that a little bit. To me, there's no excuse. If we've got a registry problem, we need to get it fixed. I think that would help a great deal. We might need to totally revamp that. There's lots of things that, diseases now that we need to be following that we're not following. So we can do a much better job of that. But I do have concerns also about perhaps duplication, and then maybe there's a better way to do this through some of the agencies that are set up really to investigate. Because along with this, you have these clusters, but the cluster might be something, there that we're eating not enough of or too much of, or, besides the environmental concerns that have been raised. So I appreciate the testimony. I think it's very, very helpful. Your written testimony I got to look at last night, and I do appreciate it. And again, it's something that we very definitely need to work on. So don't misunderstand. I'm committed to helping, but I just want to make sure that we're doing this right and that we don't have more duplication and spending our resources in a way that we really could get very, very aggressive and hold those accountable that are already doing this and get them to do a better job. Does anybody want to comment? Or yes, ma'am.
I will. You brought up a couple of points that I just wanted to hit upon that I have found interesting in dealing with all of these communities and their reporting to me. There doesn't appear to be any national people's registry where they can report what, more often than not, if somebody has cancer, and that I've learned from these communities and those with cancer, is their doctors or an agency will actually do the reporting. They don't get to do the reporting, which is why I think they've started to bring information to me. And one phenomenon that I'm seeing happening out there in this Facebook world that we live in now is emails coming from people that through Facebook have now found their old high school mates, but they've all been dispersed throughout the U.S. or in other parts of the world. And once they're stitched back together, they're actually learning that all of them have cancer and similar types of cancer, and we're able to pinpoint them back to one location. So I know there's many agencies out there that are involved, but there isn't one in particular that reports and compiles the data that are coming from the actual people and the actual sources, as this map would kind of indicate. And so they need a specific place to report to, not just CDC, but somewhere where they can go and report their actual cancer and indicate where they're from, not necessarily where they currently reside. And so being able to possibly share all the data, because I don't know what exists that CDC or EPA or ATSDR does or doesn't have about certain communities, But to be able to open the doors and share that data between local, state, and agencies to see what you have, and then be able to maybe start putting stuff like this on top of it to see what we're missing, because they're not reporting it to your agencies who are supposedly making the reports. The information's getting lost. So
no, I agree, and I think, again, the sharing of data, and as you say, we're in a Facebook age that does make that so much easier. Ms. Solomon?
Yes, your points, Senator, are very important. The problems with tracking diseases in this country are quite serious. The cancer registries have gaps in many states, and many diseases that are very important, especially some diseases that appear to be rising, such as Parkinson's disease, are really not tracked at all. And so that is an important and related issue. But I also wanted to speak about this issue of duplication, because it's a tricky issue, because in my view, coordination of resources is very, very important, and making sure that the appropriate expertise is deployed to address these clusters is also very important. And up until now, the fact that it's really been ATSDR or the states that have responded to clusters means that not all of the necessary resources are at the table, especially some of the environmental sampling approaches. In addition, when we were involved in researching our report on disease clusters, we contacted the ATSDR, which is housed at CDC, assuming that they would be tracking disease clusters and could tell us where the disease clusters are. They told us that not only do they not track disease clusters and have no information about where they're located, they told us furthermore that they are no longer investigating disease clusters. And so we said, well, if that's the case, who is? And they said, this is the role of states and local governments. Those entities don't have the knowledge and skills. So that's why legislation like this will bring all of those resources together.
Thank you. I don't want to get gavelled on, but I think the point that you make about coordination is a good one. And again, I guess I just have to look further to see if the CDC is not doing that, should they be the lead agency doing it versus the EPA? See what I'm saying? I mean, that's the other thing, Madam Chair, is and again, this is something we really need to look at in the sense that we're really concerned about spending money these days because the federal government doesn't have it.
Absolutely.
But this type of thing, improving the registries, getting some of these things under control, really would save a tremendous amount of money. So that's, I think, a point we need to make. I yield back. Thank you.
Well, Senator, thank you so much again for coming, and Michael and I are very hopeful you'll join us, and I hope you'll look at this bill. I want to answer your one critique, but also mention that I really agree with you on the cost, and I'd ask unanimous consent to put into the record this report from Cancer Facts and Figures done by the American Cancer Society. They say about 1,529,000 plus new cancer cases are expected to be diagnosed in 2010. The estimate does not include non-invasive cancer or any site except, or it doesn't, and it also doesn't include skin cancers. So, and then later on, they talk about the cost in here, and it just is mind-boggling. What are the costs? The NIH estimates overall cost of cancer in 2010 at $263.8 billion. That is $102.8 billion for direct medical costs, $220 billion for indirect morbidity costs. That's lost productivity. And $140 billion for indirect mortality costs, cost of lost productivity due to premature death. So your point is so well taken. And I think if our bill moves forward and we can get to the bottom of this, and let's say we go into a place and we find out, no, there's no connection to the environment. They may find it. They found it in several cases in California. All right, we tried. It's really genetics. If they find out that there's something in the soil or the air or the water that we can fix, now you're going to prevent a lot of these cancers from happening. So I think our bill at the end of the day, it calls for efficiency as we move forward. Now, I wanted to talk about why EPA. I think it's a fair question. This bill isn't an EPA bill. It says that all the agencies are going to coordinate. The reason we said EPA is if they find it is an environmental issue, it is EPA that has the ability to deal with air, water, and soil. I mean, that the other CDC doesn't. They will find out what the cause is, but they don't they can't move to fix it. So we wanted to give the agency that could fix the problem, if there is a problem, the lead so that this isn't just an exercise. It actually has a follow through. But if you are concerned about this, if you want this spelled out, let us work together, because I got to say this, and Trevor knows this, and he made the point that he's both the minority witness and the majority witness. In these days when we have so much rancor, I would hope we could come together around this very simple idea. So if there's something really troubling you or bothering you, you want to work with us in a positive way, that'd be fine. We want to get this out. We want to move this. We want to show America that we're not happy to see Erin Brockovich, who's a private, you're an attorney now, yes? You never did do that. Well, she's an attorney by osmosis then. You know, an advocate, an activist and an advocate for communities, that people are calling her because they are frustrated with our response. I would also put in the record a little acknowledgement here. The California EPA and the Department of Public Health expressed their appreciation to the U.S. EPA for providing important technical consultation as they looked at causes of birth defects in Kettleman. Now, in California, now the jury is out. We don't know whether this is a cancer cluster due to environment or something else. But I think the EPA can be very effective, and it's nice to get this comment from my state, so I wanted to put that in the record. So I guess, and I have to say this was written in December 2010, so this was before Jerry Brown took over. This was written by Arnold Schwarzenegger. I think it's important. It was a, bipartisan thank you. So Trevor, I would like to give you the last comment of the day from the panel. If there's one thing you could tell Senator Bozeman, because he missed your testimony, if you could sum up why you support the Boxer-Crapo bill, if you could look him in the eye and tell him what it is, that'd be wonderful.
Well, thank you, Senator, for being here. I have known many children who have lost their lives and lost limbs to cancer, and it's heartbreaking to see that, and I think that's why we're all here today, to do what we can, as Chair Boxer said, if there is a problem, that we address that. And I would also like to say that the medical community, tumor registry, the CDC, are overburdened with data. And I think that this would streamline and consolidate the process. So that's it. Thank you.
Thank you very much. Well, I want to say thank you to this entire panel, all of you. You've just helped us enormously.
Madam Chair.
And yes,
could I just say one
Senator,
thing?
of course.
Again, I guess what I was thinking, the British Navy, they had a problem in the old days because their sailors were developing scurvy, okay? And so they were able to discover that was from, lack of getting vegetables when they were on board, fruits. And so I guess what I would like is a situation where when we have a problem in a cluster, regardless of the disease, that when we go and investigate, we investigate and figure out the cause, which if the EPA came out, and again, I'm not slamming the EPA at all, but you tend to think in terms of, your training and whatever. And they established that the paint on the boat was good, the decking was good, and there was no environmental cause in that way, then we wouldn't have discovered that the people needed to be eating more fruits. So I guess that's my only concern is where we're going and what agency and how
well, this is what I'm trying to say.
I think
we include every
Solomon
agency.
said, coordinate.
Well, that's the whole point of the bill. It's the entire response is coordinated. It includes the EPA, the ATSDR, the NIH, the CDC. Everybody is involved. And in addition, we pull in the state apparatus, we pull in the local city, county. You're exactly right. You don't send in the EPA. That's not what our bill does. Our bill says we're going to coordinate this response. So everything that you said is what we do. And it's high time we did it, because I don't want to see a private citizen getting calls, because there's no faith in the government right now, because we're just not coordinated. So I hope you'll take a look at this, and I think you'll like what you see. And if you want us to make it more clear, we'll make it more clear. I want to thank so much this panel. You have been excellent witnesses, and I look forward to the day that we pass Trevor's Law out of this committee, we bring it down to the floor, we have everyone's support, and we move it through. And Trevor, life takes so many twists and turns, and it's a mystery why. But clearly, your life took a twist and a turn in a way that has given you the power to communicate your story, and the empathy and the compassion that you bring to this. And frankly, your common sense side as well is extraordinary. And just thank you. You could have gone on with your world and put this behind you and said, wow, I dealt with this in my life, but I'm closing that chapter. What you are doing is so enormously helpful, and we are so grateful. And your senator is so proud of you, and we thank you, and we stand adjourned. That's terrific. Let's try to work.
Up next on C-SPAN 2, Pentagon officials testify on Capitol Hill about cost overruns on weapons systems. The Senate Energy Committee looks into the Japanese nuclear plant crisis.